Well, hello. I would assume you are here because you either have this pink fleshy thing growing out of your eye, or you just wish to learn more about it. Well, let me first start off with the fact that this growth is not actually cancer, as some people believe it is. It is a disease that is very rare called pterygium. Pterygium is simply put just a growth of pink fleshy tissue coming out on the conjunctive or the clear tissue that's around the eye. Now, normally it will start from the brim of the nose and go to the pupil. This one is opposite, but mostly it's like that. This is not a serious condition at all. The main problem with it is that it's just very annoying. In most cases, it doesn't grow that fast. It'll stop early on. But in extreme cases, it could start to cover the pupil, as this one kind of is, and this one is getting very close to. Right here, it's actually covering the pupil. Sometimes it can go on both eyes, and when it does, it is considered bilateral pterygium. The main symptoms that come from this are the annoying ones like a burn or a gritty feeling like you got something in your eye or sand, but that's the main case of it. It could also go red, which is when that's the actual seriousness of it. That's probably the worst thing that could happen. And also sometimes before this disease actually occurs, you could have a thing called pinguecula, which is pretty much just a yellowish thickening of the eye, and that normally happens prior to pterygium. Now you might wonder why people have this. Well, this is actually caused by excessive exposure to UV light on the eye. This exposure causes dry eyes, and it can halt the development of fluid on the outside of the eye. People that are most likely to get this disease are obviously the ones around the sun a bunch, so people near the equator. And statistically, you are more able to get it if you are a male around 20 to 40 years old. Eye doctors can normally diagnose this very easily by just seeing it with the eye, but they also may look at it at a thing called a slit lamp right here. I'm sure you've seen those. And mainly when they notice this, they could prescribe you with prescription ointments or eye drops to stop the redness that will occur. If this growth is very annoying, though, then your eye doctor can remove it with an outpatient procedure. This is a picture of the surgery right there. It's pretty disgusting to most people, as most surgeries are, but it is probably one of the only ways to get rid of it if you actually wanted to. It actually is the only way, to be honest. But like any surgery, this one could come with complications, such as a return of a more aggressive growth. Could also have scars on the cornea, as well as blurred vision from an uneven cornea, resulting in astigmatism. And the only way that eye doctors normally suggest the surgery is if it is getting rid of part of your vision, or if you just really hate the look of it, and also if anything else they've tried has failed. Common procedure uses the skin from your conjunctiva or placenta to fill the empty space after the lesion has been removed. And this surgery will typically take 30 to 45 minutes, and afterwards you'll probably have to wear an eye patch for a couple days, but after a couple days you will be able to return to work as normal. And if you do have the procedure, then be careful and watch your eye, as more serious growths could occur within 12 months. Overall, this is not a very harmful thing to have. It is actually quite unharmful, I guess I would say, because it's mainly just very annoying to have, and the look is different, but it won't cause anything really bad other than a slight blur in vision. So mainly just try to prevent it, and the main way to prevent it is to protect your eyes. Just wear things such as sunglasses and a brimmed hat to make sure the sun doesn't get in your eyes all the time, and you should be okay. This is a very abnormal thing to get. But other than that, good luck and goodbye.